Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. What are all the important investigations you have to be get done for this sinusitis? First one we call as water sweep. In this water sweep, it is a kind of X-ray in which your maxillary sinus, the sinus which is on your cheekbones, will get exposed. We can clearly visualize on water sweep, and also anterior ethmoidal sinus. These are the two sinus that are completely visible in water sweep. In the same water's view, when the mouth is open, you can even see the you can even assess the sphenoidal sinus, the condition of the sphenoidal sinus. And next one is Cadwell's view. In Cadwell's view, you can see frontal sinus clearly, and you can assess the pathology in frontal sinus. Apart PNS CT, so paranasal sinus CT is one of the CT scans. It is very good in this case, so it will give complete information about all your sinuses. And regular blood tests like CBP will give you whether it is chronic or it is acute. So what exactly happening in your immune system because of this sinusitis. Next one is CRP, C-reactive protein. It gives the amount of inflammation which is already there in your system, whether it is local or systemic. It completely gives information about it. As a sinusitis patient, it is important for you to know about the anatomy and physiology of these sinuses. Basically, these are the hollow spaces in the skull. You have skull, right? In that skull, if this is the skull bone, you have hollow spaces in this like this. So these we call as sinus. There are four pairs of sinus in human beings around the nose. One is frontal sinus, it is on your forehead. Next one is maxillary sinus, it is on your cheekbones. And ethmoidal sinus, this sinus is present on the root of your nose anteriorly. In the front, it is ethmoidal sinus. And one more is sphenoidal sinus, it is also at the root of the nose, but it deeply embedded in your skull. Basically, these are four pairs, means each sinus is on your both sides. So these are four pairs. Sinuses are the hollow structures. These are lined with mucosa which secretes mucus. All these sinus will drain into your nose. So if there is any secretion in this sinus, so these secretions will be drained into your nose through small openings. Why do we have these sinuses in our skull? What is the importance of this sinus? First one is sinuses are the air-filled cavities. What happens here is when you breathe the air, these will humidify the air. These act as air conditioners to the air which you have taken in, and it will give the resonance to your voice. If your voice has to be more effective, so more pronounced, it will enhance your voice. And also, the skull is a very thick bone. To give lightness to the skull, these sinuses are present, and these are also the lining of mucus is full of whatever you inhale, so that air is cleared of bacteria, virus, and protozoans with the help of this mucosa in the sinus. These are also antibacterial. It prevent you from the brain injury. Whenever there is a shock or whenever there is a blunt injury to your face, these act as a shock absorbers. And also the lining around the sinus, they will extend the nasal olfaction. So even some of the inner part of the sinus will have olfactory sensors.